Dr. Nardine Bekhit is a chiropractor practicing at Pura Vida Health Group in Ottawa, Canada. As a musculoskeletal health expert, she has a special interest in helping dental professionals provide care without having to sacrifice their muscle and joint health in the process. She creates content on Instagram, her handle is @curlychiro, to disseminate that information and is passionate about educating and empowering patients with the tools they need to better their health. Please welcome Dr. Nardine Bekhit.
Hello, ASDA District 2. Thank you so much for having me on here today. I'm really excited to be talking to you guys. So thank you, Nick, for the introductions. I'll tell you a little bit about myself. I am a chiropractor practicing out of Ottawa, Canada, in case my accent hasn't already given me away. And as a chiropractor, my training makes me an expert on ergonomics, posture, spinal health, muscle and joint health. And I've taken a special interest in the muscle and joint health of dentists. And so what I've done is I've consumed all the research that I possibly can and put it into pretty slides. And so I normally give talks in dental offices, and more recently have been starting to talk to dental students virtually on this topic. And so this is just an area of interest of mine and something that a research area that I have read into a lot, and kind of synthesize that information for you to make it easy to understand. Without further ado, so I like to usually start off my presentation with this slide. It's a statistic from a study that was done in 2010. And in this research study, they looked at different causes of illness-related early retirement for dentists and dental hygienists. And so you can see from the graph here that MSK takes up a large chunk of that. And whenever you hear the word MSK, that's short for musculoskeletal. So that refers to the health of the muscles, joints, the skeletal system of the body. And so I don't put this up here to scare you, but in case you weren't aware already of the importance of this subject, now you are aware, and I'm sure you didn't invest all this time and money into becoming a dentist only to retire early because of debilitating neck or low back pain. So the goals of today's program, first of all, I want you to understand why these problems occur. And then we'll walk through together an evidence-based prevention strategy. So what are all the tools that you need in order to mitigate this problem, as well as when to seek professional help. So why are dentists so susceptible to MSK issues or neck pain, back pain, and another frequent area is hand and wrist pain? The practice of dentistry lends itself to a situation that isn't ideal for our body. First of all, there's a lot of sitting, a lot of awkward postures, a lot of sustained positions. Where we run into problems is these sustained positions mean that we're not getting enough circulation to our muscles and joints. And those are the things that actually allow us to maintain a healthy MSK system. So at the level of the muscles, if we're not getting enough circulation or blood flow to the muscles, we start to see ischemia in the tissues. And this is what forms those really painful trigger points, otherwise known in layman's terms as muscle knots. And I'm sure you can find those in different areas of your body that can be quite painful and annoying to deal with. And then when we're looking at joints, movement is what allows our joints to be lubricated and healthy. But if they're not getting the movement that they need, then we start to see degenerative change and joint irritation and that kind of thing. And so that is usually the starting point of a lot of these issues. So pain is our body's way of communicating to our brain when there's an issue. You know as well as I do that, for example, so if a patient comes in and they have a cavity that is painful, they're probably well advanced in their, in their pathology than a patient who came to see you before things got painful. So you know that a cavity that is painful is probably a lot more serious and more work to deal with. And so it's the same with our musculoskeletal health. So once we actually start to experience pain, we're a little too far gone in the process. Our body gives us a lot of early warning signals that if we just pay a bit of attention to, we can kind of address things head on and early, and it's a lot easier to deal with these things. So what are those early signs? Loss of flexibility or range of motion, waking up feeling a little bit stiff in the morning. Those are all signals that your body is telling you that there's an issue that we need to take care of. And it's always easier to take care of it at that stage. And so when we're talking about dealing with these problems, there's a couple components to it. First of all is having a good healthy dose of movement in our day to day, as well as correcting postural imbalances and maintaining good posture in the operatory to decrease that load on our bodies as much as possible. So I've outlined here 3 categories of risk factors that predispose dentists to MSK issues and pain disorders. And what I want to highlight to you here is that 2 of the 3 groups, or 2 of the 3 categories, are actually well within your control. So I want you to have a bit of hope in the sense that you can do a lot. There's a lot in your court that you can do to manage your risk factors and get you on the right track. So obviously there's certain things that might predispose you that are outside of your control, such as those pre-existing issues, but there's a lot that you can do to manage. Okay. And so we're going to outline today an evidence-based prevention strategy. And so there's 4 components to that, and I'll walk you through all of those things. The most important thing is that, here we're dealing with a mechanical problem. Muscle and joint pain is a mechanical problem, and mechanical problems require a mechanical solution. And so you'll see how all these things come into play. While, you can pop painkillers and Advil and kind of put a Band-Aid fix on things, you're really not solving the problem for your body, because those are all chemical solutions. So everything we're going to look at comes from the standpoint of ergonomics, posture, and the right exercises. So now would be a good time to pop up the polling question. If you can do that for me, Nick, please. So according to the literature, the most overworked muscle in the dentist is A, glutes, B, orbital muscles, C, upper trapezius, or D, wrist extensors. So you guys can go ahead and tell me what you think. And so, Nick, whenever you're ready to put up the results. Oh, okay, interesting. So the correct answer is actually C, upper trapezius. But I can see where logically you would think that wrist extensors would be it is a very important area, but upper trapezius is actually the most hardworking muscle. And so there's a couple reasons for that, just the nature of all of the postural imbalance through there, as well as when we're stressed, we tend to bring our shoulders up and almost like wear them like earrings. And so that can also further exacerbate the problem. So we'll go into talking about what are the correct exercises to be doing. And so my objective here is to help you understand what exercises you want to start incorporating, and maybe which ones you want to avoid, and what type of exercises. I know everyone has their own preferences with regards to what kind of exercise routines they want to do, what you're passionate about and what you love doing. And the most important thing is that you do what you love to do, because that's the only way you're going to do it consistently. But I want you to have the guidelines to be able to make decisions and tweak things and modify things appropriately for your body. So the way I like to break this down for you guys is by giving you the postural imbalance, the patterns that we commonly see, so that you can understand how to situate these muscles, because it can be a little bit overwhelming. So the first one I put up here on this screen is it's called upper cross syndrome, and it's called cross syndrome because the pattern forms an X, just like this. And so on one end of the X, we have our tight muscles, and on the other end, we have weak muscles. So I'm going to walk you through why these happen so that you understand. So you can see, you have the tight suboccipitals, upper traps, levator scapula. On the opposite end of that X, you have the tight pectorals, which, with being rounded forward in the shoulders, those muscles are going to shorten and tighten. On the opposite end of that, you have the weak, deep cervical flexors, and then weak rhomboids and lower traps. And those are the muscles that pull our shoulders back and down. So why does this happen? So believe it or not all muscles are created equal. And for simplicity purposes today, I'm going to break down two categories of muscles that are important to note here. So the first one is our postural or stabilizer muscles. And so these are the muscles that are responsible for holding us upright. And they're working at a low level, low force for a long period of time. And then we have our mover muscles, which are muscles that will be doing those power moves that are quick. They're not, they're not drawn out over a long period of time. Just kind of when we need them and we need to exert power, those are the ones that kick in. So what happens is when our postural or stabilizer muscles are not trained appropriately, over fatigued, or not being engaged properly, then our mover muscles will actually sub in and do the job of postural muscles. Now, why this is a problem is because those muscles aren't designed to do that. So for example, our SCM, our upper traps, those muscles are meant to be power mover muscles. But when they have to play the role of stabilizer muscles, then they become ischemic and tight and really sore and achy and can generate headaches. So here what we need to do is we need to strengthen our weak muscles. So with the deep cervical flexors, those are the muscles right here that are responsible for giving you a chin tuck or a double chin. So we need to work on strengthening those, as well as the rhomboids, the lower traps, and that will help keep us in good posture. And then we want to stretch the tight muscles. So when we're talking about, so those are the two different categories of exercises we want to make sure we have a balance of in our routines. Now, specifically, when we're talking about strengthening exercises, the type of exercises you do need to match the type of work that you're doing. So if we consider dentistry to be an athletic event, we want to train for the athletic event. So we want to be doing exercises that are similar in nature. What that means is endurance type of exercises. So endurance exercises means that it's a low number of low weights, low resistance, but a high number of reps. And that is most similar to what your day as a dentist will look like, where you're doing the same thing or a sustained posture for a longer period of time. And then for the tight muscles, obviously stretching. But there's a certain point where sometimes you can stretch till forever and ever, and you might not really see results as much. And so in that situation, when you have really chronic trigger points, sometimes it's better to take a step back and work on addressing the trigger points first before you embark on a very intense stretching routine. How we do that, there's several different ways, several different tools at your disposal. Foam rolling is one example, massage therapy, if that's available to you. I really like, this is called a tune-up therapy balls. I'll show you what they look like. So there's two balls in here. They're kind of, they look like this. And I really like these as a mobility tool to help. I just find it's a little bit more versatile to use, especially to target suboccipital muscles in smaller areas. And so those are all options in terms to help try to get into those deeper tissues and promote better blood flow into those areas. We can talk about some examples here of exercises you want to, strengthening exercises you want to encourage versus avoid. So we talked a little bit about deep cervical flexors. So really just doing a chin tuck is a sufficient exercise to start off with that. So holding that for a few seconds and then relaxing and just practicing engaging those muscles. For strengthening the rhomboids, so this is, you want to be doing kind of more of like a horizontal row like this, squeezing the shoulder blades back. Lower trapezius, that one's a little bit different, but a movement that brings your arms up like this. You can lay down on your stomach, and this is called the prone Y. So you're laying down on your stomach and bringing your arms up and just engaging that lower part of your trapezius muscle. And then for stretches, for stretching the pecs, just doing bringing your shoulder back. So you can do this with the help of a door frame and just doing a lunge forward. I'll show you a couple of stretches for the traps when we get to the chair side stretches part of this. But just some really simple head movements, bringing your ear to shoulder and down and such will do the job. Another note I will make, so you can find these tools, you can, I think there you can find it on Amazon online, but you can also do a DIY hack with this as well. If you take 2 tennis balls and put them in a sock and just tie the end, then you can kind of recreate this and start doing that at home. Okay, moving on to the low back. So now we have, again, the pattern of a lower cross syndrome this time. So similar idea. On one end, we have the weak abdominal muscles, and then on the other end, we have weak glutes. And we have the tight paraspinal muscles, and then the tight hip flexors from being in a seated position for a long time. They shorten and tighten up. So we want to strengthen the core. I really love planks for this. Strengthening the glutes, there's a lot of different ways. One really good exercise that kind of targets everything at the same time is called the bird dog. So you can Google that, or I'll show you where to find some resources to kind of walk you through some of these exercises. And then we want to do some stretches for the hip flexors and the extensors. In terms of exercises you want to avoid, you don't want to be, there's this one exercise called the Superman, where you are laying down on your stomach and lifting both arms and legs up off the floor at the same time. That is one exercise I would caution you to avoid as much as possible. The reason for that is research shows that exercise puts the most load through your spine and can be very dangerous, especially if you have some pre-existing low back issues. So there's a lot of more safe ways to strengthen your low back and get those right muscles going that are not that exercise. All right. Oh, another thing to point out here as well that I like to talk about is diaphragmatic breathing is also really a good way to get the whole orchestra of muscles working properly. So believe it or not, besides just the relaxation effects of diaphragmatic breathing, it also engages your core better and provides a lot of stability for your low back. So that's another tool to use. And aerobic exercises. So like I said before, circulation is incredibly important. So having a aerobic exercise routine as part of your self-care is also going to be a key part of this. So anything that gets your heart rate up and anything that you enjoy is fine. So whether that's running or cycling, the important thing is that you're consistent and that you do it regularly. So here's a slide you might want to screenshot. This is a summary of the information that we just talked about, and I've just kind of grouped it into with the muscle groups that you want to stretch versus strengthen. Like I said, I want you to have the tools to be able to make those decisions. It's not really a cookie cutter approach of do these exercises and you'll be fine. But here's some basics to start off with. So I'll leave that a little bit if anyone wants to take note of that. So just to reiterate again, strengthening exercise, you want to be focusing on endurance. So high number of reps, low weights, low resistance. Stretches, ideally, the research says holding stretches for 20 to 30 seconds is most effective. And then again, if you're finding that you're having a lot of trigger points, using various different mobility tools to address those trigger points and get some circulation going will be beneficial to you. All right, so that's it on exercises. So now moving on into the operatory. One of the most common problems is if you're positioning your patient too high, and then what happens is you start to do chicken wings. Your elbows go out like this. This is really horrible for your traps and everything up here. So keep your elbows close to your body, elbows down, position your patient a little bit lower so that you're not finding yourself in that position. Obviously, different areas of the oral cavity are a little bit harder to control than others. You're not going to be able to maintain perfect posture all the time. And that's very normal and very, very much okay. One of the most challenging areas, of course, is controlling the occlusal plane of the upper arch. And that's the one that will certainly start to pull the dentist forward and kind of make you arch forward a little bit more than you would want to. The best way to control this and to have a bit better positioning for yourself is to recline the patient as much as you can. Now, obviously, there are some patients who have health conditions that cannot tolerate that kind of extension in their neck. And so, you have to deal with those on a case-by-case basis. But For the average healthy patient, they won't object to it so much as long as the headrest, the edge of the headrest isn't jutting up against their occiput. So if it's well padded and well, and it's comfortable, then you can recline them a fair bit and get some good control there. If the chair that you're using is not ideal for that, you can sometimes add a wedge or a cushion to provide a little bit of extra cushioning there. So this leads me to our next subject to talk about here. This is a hot topic, especially I'm sure as dental students, you're probably getting targeted by a lot of different companies saying, this is the best thing for, this will save your back, and XYZ is the best product to have in your dental office. And so how do you separate fact from fiction? What's a marketing gimmick versus what's actually evidence-based or backed up by research? And the first thing I want to talk to you guys about is the operator stool or the dental stool. So there's this myth that the ideal sitting posture for a dentist is with your hips and knees at a 90-degree angle. So in reality, what the research shows us is that sitting with a wider angle at the hips with the thighs sloping downward a little bit is actually more protective for your low back for a couple of reasons. It engages your core a little bit better and engages your quads. So it's more of a supported standing position that you want to go for here. There's a couple different ways to achieve that effect. Number one is the saddle stool. So it does live up to the hype. Saddle stools are wonderful because of the sloping nature of the seat. It automatically puts your thighs in that position and an open angle at the hips. You can also play around with just a regular stool. If it has a tilt function at the seat, then you can kind of tilt it a little bit and create a bit of that effect. Alternatively, you could add a cushion on there as well if it doesn't tilt. You want to be careful with the saddle stool. Some manufacturers will add a tilt function to it. So in most cases, you don't really need to do that. That would actually probably put you on the other side of the problem where it'll create too much extension in your back. And so with a saddle stool, just keep it the way it is, neutral. It should be fine. And you should be okay with that. So when you're, getting yourself situated on your stool, make sure you have the backrest supporting you in the small of your back. So you should be sliding all the way back as far as you can so that you have that support. And then adjusting the height appropriately so that you have that nice open angle at the hip as opposed to a 90-degree angle. So you want to be just a little bit more of a wide angle on that. People who have a shorter stature might find it challenging to be able to scooch back to the back of the seat. So, when you have the opportunity to, if you're purchasing a stool for yourself, you want to look for a shorter seat pan. The seat pan is the part that supports your thighs. And that'll allow you to get to that ideal position. The next big topic is loops. So I've noticed that some dental students have a bit of a fear around loops of becoming dependent on them, or there might be some myths about what it what it does for your neck. And so loops, when properly used and appropriately fitted for you, are actually very protective for your neck and one of the best tools that you can have to be able to maintain a safe working posture for your neck. So when we talk about safe working posture, that means neutral neck position. So ideally, your ear and shoulder should line up in a straight line, as opposed to what frequently happens is that forward bending. And so a couple of features to look for when it's time for you to purchase your set of loops is you want to have a steep declination angle. So some companies are better at this than others. So you want to look for 40 degrees or more. And so that's what allows for you to avoid having to look down so much. And so you can just, with your eyes and just moving down and looking into the oral cavity. Another feature to look for is a pantoscopic tilt feature. So what that means is that the lens can sit a little bit more angulated against your cheekbone. And again, that helps with just getting a bit of a steeper angle so that you just basically have to move your eyeballs down. And finally, scope positioning is also really important. So if the scopes are positioned too high in relation to your pupils, what's going to happen is that you're going to find yourself tilting downwards in order to be able to look through the scopes. And that just undoes everything that we're looking to do here. So when they're positioned properly, again, that promotes a safe working posture for your neck. Quickly, I wanted to brush over hand instruments. I know that you probably don't have much of a say in it right now, but when you're in sim lab, some good habits to get into would be to avoid doing the same thing over and over again. Try to get into the habit of varying your tasks so that you're doing different motions with your hands as as you do your practice. Avoid too much exposure to tools that vibrate. That can be a little bit irritating on the nerves of the hand. And start getting into the habit of using your non-dominant hand for some tasks. A fairly easy one to start with would be trying to train yourself to do extractions with your other hand. That way, you're taking the stress off of one hand, and you're kind of balancing things a little bit better there. Okay, onto the chair side stretches. So chair side stretches will solve about 90% of your problems. Again, we want to encourage movement as often as possible. So look for any opportunity during your appointments to get out of that position and into a stretch. The research shows us that frequent brief periods of stretching are more beneficial to you than infrequent long periods of stretching. And you want to focus and prioritize the areas that are most tight on your body. So just really pay attention and kind of give those the higher priority. So we can walk through a couple. I think we're okay on time. So we'll do a couple together. It's a good opportunity to do a stretching break. So the first one we can do together is called Brugger's relief position. So how this works is, so you want to keep your arms. So arms by your side, like so. So elbows close to your body, palms facing up. And you want to turn your palms out towards the back as much as you can there, whatever your flexibility allows for. At the same time, we want to bring our shoulders back, so squeeze the shoulder blades. So that's part one of it. And then up here, we want to tuck the neck in like this. So activating the deep cervical flexors. And you can hold this for a few seconds and take some good deep belly breaths here. So that's a good one to incorporate in your day. So that's going to target a lot of different areas to just basically unwind and undo all of the postural stress that you are experiencing. Well, you can do a couple more here. Another really good one is to stretch the wrist extensors and flexors. So here we have bringing our wrist up, and so with the opposite hand, just gently giving it a pull there. So that's going to get the wrist flexors. To get the opposite ones, we'll just flip it the other way. Good, and we can do the other side. Just like that. And down. For the neck, this is really simple, just dropping one ear to one shoulder. And so you should start to feel that just the weight of gravity is enough here. If you want to get a little bit more out of this, you can take the side that you're stretching on, you can take that hand and kind of just sit on it. That'll pull your shoulder down a little bit more and get you a deeper stretch here. From this position, we can now point our nose to the armpit, downwards like that. So you'll feel a bit of a different stretch, a different muscle group being worked out through there. Good. Other side, ear to shoulder. And if you want, sit on your hand. Point nose to armpit. And just focus on your breathing here. Good. And I'll show you one more here. So taking your hands behind your back and clasping them together like so. So we're opening up the shoulders, opening up the pecs, and then you can look up at the ceiling as well. So this should feel really good. So those are a couple. You don't have to memorize all of these or scribble them all down. I will show you where you can find. I do demo these exercises on Instagram, and I'll show you where you can find me and where to find these so that you can start getting in the habit of incorporating these into your day. Be kind to your dental assistants when you're out in practice. So one of the important roles that a dental assistant plays is to improve your ergonomics, but sometimes in the process, their ergonomics can be compromised as well. So just a simple strategy so that during a procedure, they're not having to bend forward to be able to visualize the oral cavity when they need to. is just before you get started to ask your assistant, can you see? And then a simple, just, moving your fingers a little bit up or down on the mirror can make a really big difference in protecting their back health. And finally here, this is where I kind of like to dump all of the miscellaneous things outside of the operatory that you really should consider in terms of maintaining your spinal health. So firstly, when you're studying, you want to make sure that there's a couple different things you can do there to help maintain the the health of your neck and upper back. I really like using like cookbook holders, for example, to prop up textbooks so you're not looking down at your desk so much. In the world that we live in today, with a lot of Zoom lectures, having a kind of like a makeshift sit-stand desk is a really good idea to help get you out of shifting between sit and stand postures. So, whether it's a simple stacking a bunch of textbooks on top of each other to get your laptop up, or purchasing a laptop stand to put on top of your desk. You don't really have to break the bank with this. You can kind of DIY this so that you have that option available to you. Be careful when you're on your smartphone. So the habits that you use, if you tend to be scrolling and looking down like this all the time, not great for your neck, obviously. So just bring it up to eye level. It's gonna play a big role in protecting your neck. Relaxation, stress management techniques are incredibly important. Not just for your mental health, but for your physical health as well. You may have experienced during times of increased stress, our muscles and joints will actually start to feel that as well. So incorporating that is incredibly important. So meditation, mindfulness, yoga, those are all really wonderful. And your sleep posture, avoid sleeping on your stomach. If you didn't know already, sleeping on your stomach is not the greatest for your spinal health. Sleeping on your back or side are equally healthy. You want to be supported. You want to invest in a good mattress, good pillow. Most important feature to look for is a really great return policy. Pillows and mattresses are an incredibly personal decision. Not every pillow is going to work for everyone. And so you don't want to invest in this very expensive pillow only to find it doesn't agree with your body and you continue using it just because it's expensive. So, it takes a bit of trial and error, but really what you're looking for is good support. So your pillow should be able to support your neck in a neutral position, regardless of what position you're sleeping in. Don't crack your own back, crack your knuckles, crack your ankles, whatever, I don't care. But when it comes to your spine, that's a bit more of a sensitive area. So as much as you guys are probably irked by all of the DIY orthodontic treatments that are out there that some people are using, that's the same pet peeve for me as a chiropractor. So leave it to the professionals. Don't self crack. Don't. It may feel relieving at the time, but you really could hurt yourself and cause problems for yourself down the road that you don't realize. When to seek care. So just like how everyone uses their teeth on a day-to-day basis, we all use our spines on a day-to-day basis. So no one's really exempt from getting a spinal or health, a spinal checkup, just like how no one's exempt from getting regular checkups at the dentist or dental cleanings. So I really would encourage you to get checked out just to make sure everything's in good working order and you're in good shape. Generally, if you're experiencing pain that isn't going away within 1 to 2 days, you really do want to get checked out and get it addressed properly. But better yet, don't wait until you're in pain, so that you're one step ahead, and so that it's less of an intensive care to resolve your issue. So in summary, MSK pain is common, but not normal. You don't have to live with this. There's a lot of things that you can do to take back control of this, and both from a preventative and a pain management strategy. We talked over some strategies in order to both, to maintain your practice longevity. So, in terms of an ideal order to go through things, I'd recommend, starting with looking at your ergonomics, developing good habits in the operatory to position both yourself and the patient properly. Second would be addressing the trigger points. So the tune-up therapy balls, foam rolling, whatever it is that works for you, getting those muscle knots addressed and taken care of. Then starting to incorporate chair-side stretches, as well as an at-home targeted endurance strengthening routine. Try to aim for 3 times a week with that one. And seek help if necessary. So here's where you can find me on Instagram, Curly Chiro. Chiro is in chiropractor, not Chiro is in the city. You don't have to have Instagram in order to be able to access this. If you just go on the website, you'll be able to see it. I've put in a screenshot here of my IGTV. That's where most of my really good stuff is. So there's some exercise tutorials there. So there's a chair side stretching demo, so a basic strengthening routine that will target all of the muscle groups that I listed earlier. A pre-clinic warm-up that I'm actually quite proud of. This is designed to get your joints warmed up before you start your day with patients or in the lab. And then the 3 videos you see there with my face on them, those are all demonstrations of how to use these guys. And there's some bonus material in there as well. So there's the one with the forearm and wrist. There's a wrist warm up at the end. Self-massage for low back. There's some bonus stretches in there as well. And then neck and upper back is, that's one of my most popular videos that people like to, you can watch it a few times and after a while you kind of get used to it and know what to do. And my DMs are always open. If ever you have any questions or suggestions or things you want to see, I'm more than happy to engage with you there. And so that just about wraps up my presentation. I will give you one more resource to check out if you want to do the reading and research yourself. The website that I find most helpful is called Posturodontics. She's a physical therapist who's married to a dentist. And she puts out some of the best research out there. And most of the time, that's my go-to reference for best up-to-date research on ergonomics for dentists. So we can take some questions. I think we have a bit of time.
Thank you so much. Yeah, so if anyone has questions, please just drop them in the chat.
All right, so I do have one question here. Someone wants to know about acupressure mats that help to stimulate blood flow and helping with back pain. She wants to know what your thoughts are about those.
Those are starting to, actually, I'm starting to see those pop up more and more. Every once in a while, there's always something that becomes trendy. And so I'm seeing that a little bit more. And just, for the Christmas season, there was massage guns were all the rage. So yeah, no harm in using those things. The way that works is, I don't know too much about it, but I understand that there's some, pressure points and stuff that if it feels great, if it feels good to you, if it feels relieving, sure, there's no harm. But I hesitate to say that there's, a magic bullet that's going to fix all of your problems. What really is going to help you is a combination of your active care, so your exercises, your habits inside and outside of the clinic, and then getting professional help. Nothing really replaces seeing a healthcare professional, an MSK healthcare professional. So whether you like to go to a physical therapist, a chiropractor, massage therapist, doesn't matter. Just getting that professional attention is one of the more important components to that. If you like acupressure mats, sure, go for it. But, if you're expecting it to be a magic bullet, probably not.
Great, thank you for that. I don't have any other questions that were sent to me unless you do, Nick.
I just have a question about, let's see, how much time per day do you dedicate to posture stretches?
Mm-hmm. So for chair side stretches specifically, my recommendation is every 45 minutes. And so getting it in as much as possible is the most important thing. And then from there, it's pretty individual, you know, in terms of what you do at home. You kind of have to play around and see that, because everyone's in a different stage with their physical health and the demands on their body. For when it comes to strengthening exercises, ideally 3 times a week or more. You want to have recovery days though. And then as those exercises become easier, you want to progressively increase the difficulty. So yeah, that's a
Great, thank you.
I see a couple thank yous coming in there. So you're welcome, you guys. And it's been such a pleasure and I had so much fun talking to you guys. So thank you for having me on.